So my name's Gregory Zengo. I'm an OBGYN by trade. I used to be on faculty at Emory for a good while, and then I broke out into private practice, got into aesthetics, starting with toxins, fillers, vein treatment in 2002. Realized how difficult it was to train in aesthetic procedures. So I founded Practical CME Medical Training, all physician, faculty, all small groups, all accredited, both online and live training. And we actually wrote and got accredited the first ever microneedling and PRP CME training course now 10 years ago. All of our courses are fully accredited, whether you're a physician, nurse practitioner, PA, or RN. We have courses online, and we have a course sold by DP4, which is fully CME accredited, and it's really cool because it not only has our full microneedling CME content that is unbranded, but it also has a special section that you can't get anywhere else on using the DP4 equipment with the serums and, of course, the home care. And so some of what you'll see tonight are a few excerpts from that home care regimen. So this is the link on our website. I will go on ahead and post it in the Q&A as well, where you can go on ahead and order that course. The Q&A, again, is going to be the triangle, square, and circle on the bottom right of your screen. That's where you can go and order the course. And what you're going to get is a login, and you're going to be able to log into the content, play it, stop it, pause it, replay it, skip around. It's indexed. There's links to the primary literature that you can read. And there's also narrated treatment videos that you can watch. And you will get all of this for 2 years, including free updates. When you are done with the course, you take a post-test fully online and print your certificate. You could theoretically order the course and have your certificate the same day if you wanted to spend that much time on it. So it's really important. There are people who have gotten discounts on their medical malpractice insurance by showing accredited training. So I think it's really important, and I think it's something everyone should have. And hopefully, if you've learned anything tonight, imagine what else you will learn when you take a course like this. So tonight's topic is going to be microneedling and topicals, and this is mostly about home care. So these are the topics we're going to talk about. Hyaluronic acid weight is extremely important. We're going to talk about some harmful ingredients, and then we'll go over the 4 main steps of post-needling skincare, which is cleanse, treat, hydrate, and protect. So let's go on ahead and get started. But first, do you realize that microneedling devices have to be FDA cleared? If you are using a microneedling device in practice and collecting a fee for it, you must use an FDA cleared device, because the FDA has decided it's now under their jurisdiction as of 2017. The first pen that got this clearance was Skin Pen in 2018, and there are now a total of 6 cleared pens. If you are not using any of these, you should not be treating patients, period, because you are out of the standard of care. To the best of my knowledge, there are no rollers or stamps that are currently approved for clinical use by providers as well. Mentioned this last week. I'm going to mention it again. I've been using this equipment and these serums and this home care regimen now for a little over a year. Prior to that, I was using the Skin Pen and the Micropen Evo. What I have noticed after 1 year of this equipment is we have doubled the number of initial patient treatment packages sold. A package for me is 4 treatments. We have tripled the number of treatments performed in 1 year, and we have 5 times the rate of package renewals. We are getting an 80% renewal rate, meaning when they get to treatment 4, they are ready to do treatments 5 through 8 and sign up for that. And I guess my question is, with whatever you're using, are you getting something similar to that? Because it's not me. I'm the same dude that was doing microneedling a year and a half ago. It's the pen and it's the products. Really important, topical products generally don't get through the skin. And of course, we are used to using topical products that are made for intact skin, right? That's what's sold in Walmart and CVS and the like, and on Amazon online. Everything is meant to be put on intact skin. But even then, only 7 to 10% absorption. But when you needle, you create channels, you create these easy passageways all the way down to the dermis, assuming what your depth of needling is, and you will get about 80% absorption. That is a huge difference, but that comes with a big responsibility. The responsibility is now you can't put bad things on the skin. If you put something bad on the skin and 93% of it doesn't get absorbed, then you might get away with it, but not with needling. And so if you treat patients and then you just send them off to continue using their current home care regimen, or to go to a pharmacy or Amazon and just pick something at random to put on their needled skin, they're probably going to do harm. They may even undo a lot of the good results you got from your channels alone. I show this slide a lot, but this old study basically looked at biopsies of skin in mice, and A here is baseline. B is topicals only, and you see there is an effect, but the effect is extremely superficial. A little bit of reorganization of the stratum corneum. It's a little more linear, probably going to slough off a little bit better. It's softened, and a little bit of improvement at the epidermis, but that's about it. Not a whole lot going on below. C is microneedling alone, and D is both. So you need both. I've always said the benefits of microneedling is 50% the procedure, 50% the topicals, both in treatment and at home. This is a good book. It's a little old. It's from 2018, but I think his initial chapters on the science of skin and what topicals do to skin, I think, is really important. A lot of his conclusions and protocols about needling themselves are a little outdated, but definitely at the beginning, I think it's real helpful. And looking through his book and other sources, there are definitely some ingredients that are permitted. Your home care regimen doesn't have to have all of these, but growth factors, of course, exosomes, because they don't have any immune activating proteins on their outer cell membrane, so they're not inflammatory. Retinol palmitate, vitamin C, beta-carotene, resveratrol, kojic only if you have pigment, zinc definitely if there's acne involved, proline, lysine, 2 amino acids. These are all natural things. These are all relatively fine, but we've got a lot of problems. And if you go through your shelves at your local retailer, you will see things that have artificial colors meant to look pretty on the shelf, things that have perfumes meant, or it could just say fragrance, meant to smell good when you spray it, preservatives, parabens, benzyl alcohols, strong acids like alpha hydroxy acids or salicylic acid. Remember, you don't do chemical peels on freshly needled skin unless the patient has shown they can tolerate it. But as a rule, you don't use these strong acids. Now, vitamin C, ascorbic acid, is a weak acid, so that's a little bit of a different story. But anything that you would normally use as a chemical peel, you don't want that in your aftercare, yet a lot of over-the-counter products have it because they're meant to be put on intact skin, and their goal is to soften the stratum corneum. So all of these things we want to avoid. And if you send your patients home to use these things, they will get in trouble. So we talked about hyaluronic acid being sort of the cornerstone or the solvent of all home care, and it's true. It is the most important hydrator, and it is good post-needling until the channels close. Maybe doesn't have as much effect on intact skin, but it is your cornerstone for keeping that skin hydrated. However, hyaluronic acid is a polymer, so it can be as long as you want it to be. It's a repeating glycosaminoglycan. Now, you can have a short chain or you can have a long chain. Basically, the longer the chain, the thicker it is. Now, how many times have you gone on Amazon, bought the cheapest hyaluronic acid in a dropper bottle, you put a drop on your hand and it runs down the side like water? That is a low molecular weight. You can even go buy some of the more expensive products out there, Skin Medica and things like that, and they won't tell you the molecular weight, but they'll say it's digested, meaning it's got a mix of molecular weights. The low molecular weight product is mainly meant to get better absorption and intact skin. The high molecular weight products are going to get absorbed on needled skin. But the difference is, and if you can look at this paper, and we have the full text link to this paper in the full CME course, when you start putting low molecular weight hyaluronic acid on needled skin, it gets more pro-inflammatory. And the more inflammation you have during the healing process, the more likely you're going to run into issues with increased pigment or redness or just a poor quality result. So you want that healing process to be really gentle. So now let's talk about the general steps of skincare. And the general steps of post-needling skincare are true for 3 to 4 days post-treatment. And anytime, you walk into the bathroom to take care of your face and come in at a minimum morning and night post-needling, you need to do these 4 steps. So step 1 is cleanse, and that's there to get debris off the skin, protect the moisture in the skin, remove makeup, and keep those needling channels open and clear. And the one I use is Tri-Phase Cleanser, which comes in my starter kits. And you can see some of the ingredients there, all natural ingredients, nothing that is contraindicated for needling. In your acne patients, you can use CLR Cleanser, which has a little bit of salicylic acid, but not such a high percentage that it will be an issue, but you'll get that a little bit of extra antibacterial property. Step 2 is your treatment serum. And here I always say do no harm. Treatment serums is where you'll find the biggest variation. And when you go sort of outside of your comfort zone, or you let patients go wild and pick these treatment serums, some of which can be extremely expensive, you can really run into some problems. So if a patient insists on using any treatment serum, you definitely want to review the ingredients with them beforehand. I always give a mask to my patients, which is usually Hyla Active. Hyla Active is DP Derm's high molecular weight hyaluronic acid. It's got some other incredible ingredients too. We'll talk about it in a minute. Have them do a second mask on that day. I'll use Bright Light Mask if it's pigment indications, Hyla Active for everything else, just to get the day off to a good hydrated start. The MG serums we'll talk about next time that we use in office are not given to patients. And then in step 2, patients should then, after their day 1 mask, can use antioxidant cocktail, or they can use an exosome preparation. Again, you see the ingredients here. If that patient has really sensitive skin, you can go with Hyla Active, but you have a lot of options there. And then your correction step, I like to split this up. In the morning, I'll use something like Vitamin Rich Repair, which has all the necessary vitamins we need for a good scarless, low inflammatory healing. And possibly in the evening, either use Vitamin Rich again, or you can choose Retinol Active, which has anti-inflammatory copper peptides, resveratrol as an antioxidant as well. So it's really nice to have all of these things at your disposal. Now for pigment, I do things a little bit differently. I use my Kojic containing Bright Light in the morning. I'm also using a mask with Bright Light in it. So I'm getting a good dose of Kojic deep into those channels, and then use that Retinol Active in the evening. Finally, step 4, or the next step, step 4, moisturizing. And you've got some options here. You can, again, go back to your Hyla Active. You can use something like Skin Veneer, which also has a high molecular weight hyaluronic acid built in. Or if in the case where you have oily skin or acne, you can use the CLR lotion. So you'll have a CLR cleanser, and you'll use that with a CLR lotion. And then finally, this is the only step you do once a day, and that's protection, and you'll need a sunscreen. And they also have a sunscreen that is effective, but not going to be pro-inflammatory to your needling channels. So I really like the Cover Recover. I prefer the sheer, but they have 10 shades of tinted as well if you want to try to really match that patient's skin tone. So you've got those steps, and these 5 steps have to be done the first 4 a.m. and p.m. minimum, and step 5 a.m. only for at least 3 days post-needling while the channels are open. And then we allow the patients to go on ahead and go back to their regular home care regimen, which hopefully you've already reviewed with them. And what I mentioned last week when we talk about cost is that a lot of times when I review the home care regimen with the patients, I actually try to talk them out of some of the really expensive stuff that they're putting on their intact skin that's probably not getting absorbed. And I can get them in these products to be used all month and get better results at a lot lower cost. So again, that can be a good cost deferral approach if you can remake their home care regimen, because a lot of people are wasting money on really expensive treatment serums. So DP Derm makes it easy because they package this into home care starter kits. They now come in boxes. The price is really reasonable, about $69, $79. I can usually get about 12 days out of one of these. I will supply extra masks because there only one mask comes with it. But I can get about 12 days of use out of this, which would be the post-care for 4 microneedling treatments, which is one package for me. And you'll see what's in each of the 4 kits that they have. With the one that used to be called pre-post procedure, I think it's just called DP4 post procedure now. That's kind of my default kit because it's got a lot of hyalactive in it, which is sort of just my favorite because I do have a lot of patients with fairly sensitive skin. Notice all of them end with the Cover Recover. That's a must. So to summarize a little bit, for home care, the patient, you have to make sure the patient understands they are to use nothing that they are currently using on their skin at home during the 3 days post, and only to use the products we provide. And that will reduce a lot of bad outcomes, or will enable them to get the most out of their first 4 treatments. I do make sure they use the mask immediately after treatment, and I give one to the patient either for home use later that day, say they had a morning needling, or if they had an afternoon treatment, they'll use it the next morning. So I give extra masks with the starter kit. And then I do stock larger versions of some of these home care items because a lot of patients do want to get refills, or they use too much and they need to get refills. So you'll want to stock those too. We talked about this some last time, but our expectations for treatment every 4 weeks for some of the more inflammatory things or pigment like acne, inflammatory pigment, melanocytes, that cycle is really quick. Scalp, a lot of the studies have allowed for every 4-week treatments to see the best result for hair density. And so there's good evidence there in the literature. Every 6 weeks is more your default. And the reason is that you're making, when you make needle channels in the skin, you are making collagenase, which is hoping to break down a little bit of the skin as you remodel it. And you definitely don't want to come in and make more collagenase from a treatment that's too early, which will destroy the remodeling from the treatment before. So not too quick there. And then we never judge improvement until after 4 treatments. Although I got to say, I was in Seattle last weekend and we had a full class and we did 5 microneedlings on some of our attendees and their patients. And one of my attendees, who was a 72-year-old nurse who's retraining, actually received a treatment, and she was willing to go, the full 1 millimeter deep to endpoint 2 on her wrinkles out in her cheeks. And she just emailed me today about how she was, blown away with the results. And that's just from one treatment. So that's pretty impressive. And I never got feedback like that with my prior equipment and with prior home care regimen and the prior treatment serums I was using. I mean, the first pen that was ever FDA cleared packages their needle head with a tube of glycerin. And glycerin's got zero activity other than being just a lubricant to allow the head to pass along the skin. So this is a big advance, these treatment regimens. So anyway, short and sweet this time, although, oh, it's already 6:23. So, so that's kind of what I do when I look at a patient starting a new package is, number one, what are you using at home? Emphasize that if there's anything really expensive that isn't working, we try to get them to stop it. If they're using things like Retin A, or they're doing an awful lot of exfoliation, you know, crystal scrubs and acids and Retin A and all that stuff, I may actually tell them to stop that for 7 days post-procedure, because every microneedling has an exfoliation built in. You perforate the skin, and all those little islands of dead skin are going to flake off on their own. You won't see them. So from that perspective, we try and simplify their home care regimen before we even do a treatment. And then we introduce them to the right home care regimen using these products, and it's automatic from there. And we have one little cheat sheet page that we give them so they know which product to use at what time of day. And anyone who takes the course, I'll be glad to share that with you. Of course, if you sign up for the course, you'll get my direct email as well. And we can answer any questions you have about technique, specific patients. I've had attendees share pictures, you know, pre-procedure pictures of their patients, and ask about, you know, what regimen would we pick, what serum, what home care, what depth. And so it's a lot of fun. And you'll have the access to the course for 2 full years. There will be a lot of updates during that, because microneedling is always advancing. And so I'm going to pause there. If there are any questions, go to the triangle, square, circle icon on the bottom right and hit me up, and we'll see what we get. Don't see anything yet. Wow, I was that good, huh? It's just all crystal clear. That's amazing. Go back to a couple things. One thing I want to stress again was one of the first slides, and that is, so many people, not all hyaluronic acid is the same, and so many people are just going on Amazon buying hyaluronic acid in little dropper bottles. But if you don't know the molecular weight of that hyaluronic acid, you know, if it's runny like water, then it's probably not the best thing to use on needled skin. And granted, this is just one paper. But still, it really resonated with me. And until we have proof otherwise, I'm going to stick with the high molecular weight stuff on needled skin, because I don't want to potentially do anything pro-inflammatory. So first question, how soon can patients schedule other treatments like standalone peels or injectables? So let's start with injectables. So if they're coming in for Botox, I will do their Botox at the end of the microneedling treatment because their face has already been cleaned. And but I don't want to manipulate the Botox around with my needling. So I'll do it right at the end. And that works for me. Filler, I don't want to do at the same time of a microneedling. So I'll want to do that a couple weeks later. I don't want them healing from a microneedling treatment and getting filler at the same time, unless we are injecting PRP and they need to get topical PRP at the same time. Then we'll do it at the same time because we've spun the PRP. Now, I've talked about in prior courses, topical PRP can be helpful for acne scars and scalp, but it is not something people need to do every single treatment as well. As far as standalone peels go, ask yourself the question, if you didn't microneedle them, how often would you be doing those peels? And because the microneedling treatment itself, the needle punctures themselves take the place of one of those peels. So I would not do a peel in that interval prior to the needling, and then I would count the same interval after. So possibly 2 weeks. We can only exfoliate so much. Now it depends. Is this going to be a really weak peel, or is it going to be something like, TCA? I wouldn't recommend doing any TCA during a package of 4 microneedling treatments. I'd rather let my microneedling do the job. Instead of using the hand raise, if you don't mind, type your question in the triangle, square, circle icon on the bottom right. Next question. I joined a little late. When do you recommend restarting skincare products beyond gentle cleanser and moisturizer? So I recommend doing the DP4 post-care regimen immediately. And that means doing the mask and the PM regimen that night of the needling treatment. So that involves a cleanse, a moisturizer and or hydrator, and a treatment step. And then the next morning, you'll do all the steps again, plus sunscreen. Makeup, generally speaking, I tell them if it's a mineral makeup, they can definitely wear that the next day. Otherwise, they just want to be very careful about anything that could clog up the needling pores. We want those channels to stay open. The mechanical part of needling is still half of the benefit. So we want to keep those channels as open as possible. Thoughts on exosomes after treatments? That's an entire webinar. And that's always changing, and not all exosomes are the same. So it's going to depend on which exosomes and when. And I think we'll have some pretty good ones that are matched up with microneedling post-care to talk about when we get to that webinar, probably in January. Another question. If a client is so regimented to their cleanser that may be mild, can they use that? Yeah, so if it is a truly mild cleanser, just check the ingredients, and make sure there's no grit in it or particles that are going to then go and irritate the skin trying to further exfoliate it, or any acids. A lot of cleansers have AHA acids in them. I probably wouldn't do anything like that, but I have a lot of clients that love their Cetaphil, and so I'm okay with that. But all of my patients are getting a better cleanser that is microneedling compatible, so they generally just use that, and they're real happy with it. Yeah, and so, I've talked a lot during this presentation about how important hyaluronic acid is. Hyla Active, which is in our masks and in our standalone serum, or not serum, but recovery hydrator that we use in the post-care kits, also is an ingredient in many of the treatment serums, as well as in some of the other post-care products. And that is, mostly a high molecular weight hyaluronic acid. There's 3 different molecular weights in hyaluronic acid, but it's really, really good post-needling. And it's probably, one of the biggest factors in why I'm getting so much better results compared to what I was using in the past. All right, one more question. Just to confirm, you mentioned it was safe to combine microneedling and neuromodulators on the same day as long as neuromodulators. Confirming it was safe, I'm not sure. I do it. I do it because my patients a lot of times will time their toxin and their microneedling to the same visit. And once I am fully done with the needling, at that point, I have a clean, if not almost sterile face to work on. And I can go on ahead and do my Botox at that time with, and I've never had a problem doing Botox, even if I massage high molecular weight hyaluronic acid into the needling channels, and some of that gets into my toxin injection channels. I've never had any issues with the uptake of the toxin or the quality of the treatment. And patients sure like to be able to take care of both of those at the same treatment. So I do it. I don't know if there's anyone where we could say it's been confirmed to be safe. I'm not sure I know what safe is, but I do it because the skin is clean and it's the last thing I do. Their skin's not being manipulated after that point. And of course, I tell my patients when they get toxin, don't rub, touch, or otherwise, manipulate the injected areas for at least 3 to 4 hours. So they're going to go home after getting their hyaluronic acid mask, and they'll be good for that period of time until they wash their face. All right. Well, I think that's it for tonight. I appreciate the questions, and they will let you know when there's a recording posted of this. In 2 weeks, it's Thanksgiving, or pretty darn close. So we'll take that off, and I will see y'all again in December. Thanks a lot.